How do we determine the atlas is out? We don't use X-rays or any thermal instruments or any imaging. We use kinological tests. So we start with palpation, we test the function of the joint, and we look for the compensation patterns. These are very obvious things. Where I worked in Croatia, we have an imaging facility in-house, MRIs, CAT scans, X-rays, all that stuff, and we immediately used it, and many times we did a treatment before and after a CAT scan. We did a CAT scan before and after the treatment, right there in the room, just to get accurate imaging. But really it's not necessary because, well, first of all, the malrotation is obvious, it's usually several millimeters. Second of all, I'll show you that the method is safe regardless of how much or how little the atlas is rotated and to which degree and angle. Right. So what makes this method completely safe is there's no actual direct manipulation of the atlas vertebra. We have a handheld machine that has a vibration, works on a specific frequency, and with that machine we massage the muscles, the short muscles of the neck. And then it's not a relaxing massage, it's a massage that activates the muscles and exhausts them. And we actually have antagonistic stimulation of the muscles, which, if you remember from anatomy physiology, the C1 is a myotone, so it's a single nerve innervating the joint, meaning that we get antagonistic muscular contractions. The dependent factors are the frequency, the amplitude, the duration, and the direction of the vibration that causes the muscles to be completely fatigued. And once the muscles are completely exhausted, the atlas goes in an anatomical optimal position. Again, which makes this completely safe. We have a very short list of contraindications for our treatment, so most people can get this treatment. As a chiropractor, I know that many patients that need a chiropractic treatment the most are contraindications because they're too old, too frail, and you cannot proceed safely with adjustment. The beauty of this method is that there's no upper or lower age limit, and there's almost no contraindications for getting a treatment done safely. Here, I talked about the mechanics of vibropressure pressure a little bit more, and the overload on the Golgi tendon organs. So expectations. So we see that the atlas is out, we see that it wreaks havoc in the body, really causes pain and headaches, and see what we can expect from the method. As Dr. Elizabeth mentioned, immediately we have postural changes, the center of gravity changes, it moves actually back and up, and person studying heart rate, even weight distribution left to right, front to back. Simple things such as bunions. I have many patients that bunions go away because the uneven weight distribution would cause that bunion to flare up. Flat feet, we had actually patients that regain an arch after a treatment in a foot, which is really odd and unusual. And how those patients notice it, usually because nobody looks at the sole of their feet, they notice their shoes a little bit big. Once the foot gets an arch, the footprint's a little bit shorter. So here's a good before and after image. We had another study that we did on the stabilometer, which measured the weight distribution, and shows the weight distribution before and after a treatment. And you can see that the patient was leaning on one side. I had a meeting with the trainer for the men's national soccer team before I went to Brazil, and he was interested in that and how it affects the performance of an athlete and efficiency of movement. I also treated many patients before I went to athletes before I went to London Olympics, one got gold. So great results with healthy people who don't have any ailments, who just want to be more efficient in their movement. Here's a study that was done in South America, in Bogota, it's actually Colombia and Ecuador, and I was there last month meeting with the doctors. These are 9 common ailments, basically neck pain and back pain with or without herniated discs, fibromyalgia, epilepsy. We have great results with epileptic seizures, by the way. Headaches, carpal tunnel syndrome. And you can see that a large group of patients, the number of patients on the right, so it's many hundreds of patients in the study. And the results, although some results are immediate, the regeneration of the disc in the lumbar vertebrae took about a year and a half. And we had MRIs before that. And by the way, all this information, besides being in your syllabus, is on our website, but unfortunately our US website doesn't have near the information, so our Latin American website in Spanish has all of the studies and all the MRIs of these studies before and after, so you can really spend a lot of time if you want. If you use it. Chrome browser, you can translate automatically to English. So we see that immediately after the treatment we have improved posture, we have a significant reduction of pain, increased oxygenation of the brain. Which faculty of the brain wouldn't benefit from increased circulation or oxygenation? We really have all functions of the brain benefit from that. Improved ability to rest. Almost everybody reports an improved quality of sleep after treatment. And something that many people don't think about, but reducing the negative impact of falls and accidents. Your body's more stable, you're less likely to fall. And as my sisters here know, our late grandmother, she was pretty healthy, but then she was well unstable and she fell and she broke her hip and that quickly, ended her life. So we have great results across the whole spectrum. What I'd like to say a few more minutes is that the method is completely safe. If there's any chance of injury, I wouldn't treat my children. I treated my daughter at birth and I treated my son at the age of 6 months. And so kids are really healthy. They're typical, I have a 3 and a 5-year-old now, that's how they're now. And they're typical kids, but in terms of biomechanics, they're really optimal.